7-year-old Zali Habel loves spending time outdoors with her family in the remote town of Streaky Bay in South Australia.
I love to be with my family. They're super fun to hang with. I like watching the sunset with them, going fishing, going surfing. Just love to do everything with them.
Yeah, you'll catch one.
No.
But she's had to wind back her passion for sport in recent months after she was diagnosed with a rare type of bone cancer in her leg called Ewing sarcoma.
I didn't really know what it meant, but, I just kept asking the doctor, am I going to die? Because that's all I knew about, cancer at that stage.
Zali finished her treatment at the end of 2021 and is now getting back to the things she loves. But before she started a year of aggressive chemotherapy, she was forced to face questions most 10-year-old girls don't about whether she'll be able to have a child at the end of it all.
Zali was diagnosed with a cancer that required intensive chemotherapy. This chemotherapy has a high chance of damaging future ovarian function.
I guess when we got the diagnosis, we were dealing with that. That was the biggest issue. And then suddenly for them to come out and talk about fertility, we went, oh, yes, of course. Forgot about things like that.
Hi, so exciting to see you. Zali, you look amazing.
Zali and her family spoke to Dr. Kate Stern at Melbourne's Royal Women's Hospital about an innovative procedure known as ovarian tissue freezing. Dr. Stern helped establish the program at the hospital 26 years ago.
If you're a young person who's been diagnosed with cancer, not only do you have to deal with the trauma of your diagnosis and the trauma and difficulties associated with your cancer treatment, but you have the very real risk of losing your fertility in the future.
Oh, maybe we could commute and get the treatment done and then...
Because of Zali's age, she wasn't able to do more routine procedures like egg freezing to preserve her fertility. So they decided she would have part of her ovary removed and frozen before she started chemo.
I knew I had to do it because if I wanted to have kids in the future and the chemo killed off all my eggs, then I knew that was really my only thing to rely on.
We had no idea about these options. It was amazing that it was offered to us and that we could take it up.
Though it's been around for almost 3 decades in Australia, ovarian tissue freezing is still relatively uncommon. Around the world, about 170 women have given birth from frozen ovarian tissue.
Freezing of tissue is not experimental anymore. We have had such good success around the world that it is now recognised as a genuine treatment for patients for future fertility.
The procedure is described by doctors as very specialised but relatively simple to perform. They remove part of the patient's ovary via keyhole surgery, freeze it in special tanks, and then when the patient is ready, the tissue can be defrosted and implanted back into the body.
And over 4 months or 5 months, that tissue gets a life of its own. It gets new blood vessels, the follicles and eggs start to develop, and it makes hormones. It is absolutely miraculous, we think.
You go for a little walk. This morning she walked, she took her first steps. Her communication is increasing.
In Melbourne, 38-year-old Sarah is at a very different stage of life to Zali. She went through a decade of on and off cancer treatment and has now been in remission for 2 years.
Hey, you can go.
Sarah's extensive treatment for her cancer damaged her ovaries so that she was in a state of what we call premature menopause. Her ovaries did not have any good eggs in them. So Sarah needed to have this ovarian tissue grafted to be able to have any opportunity to have a baby.
Hello. Sometimes I do think about that. I think that, she was, that tissue was frozen for 10 years outside my body and then, a decade later put back and all of a sudden here she is. And it seems quite surreal. And then at other times she's just like any other baby and you're just sort of worried about what she's eating and is she sleeping and all those.
It's been a long, difficult journey to motherhood.
It was in early 2009 and I had a lump in my neck and I just went to my GP and we thought it'd be sort of more of a virus or something like that, and it turned out to be Hodgkin's lymphoma. And at the time, the main things I was worried about were, you know, am I going to die? And things like, is my hair going to fall out?
When did the issue of fertility come up?
I don't recall really thinking about it at all. The first oncologist I saw I don't think really raised it.
Luckily, Sarah's mother raised the issue, and Sarah eventually got in touch with Dr. Stern at the Royal Women's Hospital.
That probably was our one opportunity to think about it, and we almost missed it.
The urgency of Sarah's cancer treatment meant there was no time to freeze her eggs, so the ovarian tissue graft was the only option. And now she's so thankful she did.
I had treatment on and off for about 10 years. It would have been pretty certain that I wouldn't have been able to fall pregnant without something like this graft tissue.
While it's no longer an experimental procedure, Dr. Kate Stern cautioned it does not guarantee the woman will fall pregnant.
Getting good eggs is still hard work, but the treatment is quite successful. It depends what your benchmark is, but for these patients, it's this versus nothing.
For Zali Habel, the future is also looking very bright.
I'm going really well. I'm back at school. I'm doing most things that I love. Obviously, I can't really run. I'm looking forward to going and doing the things that I love again. I'm looking forward to, grow my hair back.
Zali's much better. She's certainly put on weight, is happy in herself, has got a carefree attitude back, so we're super glad we've got her back.
It's all right.
Hey.
Yeah.